Okay guys, so in this video we're going to go through cervical spine PA mode. So Glenn, how do we go about this?
So we've got bending prone, really nice position when you want to identify specific levels. Okay, so we've got a couple of ways of doing that. So if we look at the most prominent spinous process here, there's usually two actually, so two more prominent spinous processes. We're going to get Ben to just lift his head, and then the top one should disappear and lower your head for me, Ben, and that's C7, so you'll be sitting on C7 when you do that. And if you come off of the base of the occiput, you're going to be sitting around C2. Okay, so if you want trying to orientate yourself around the cervical spine, really nice way to anchor from the base and above, and then obviously you can palpate in between. So if I'm looking at doing PAs, we've located C7, I can come across here, and then I always will mobilise the side on which I'm standing. Okay, so if I'm looking at unilateral PAs on C7, I'll be on Ben's right, I'm standing on his right hand side, and then I'm just applying a force through there with my thumbs. On most of the rest of the spine I tend to use this part of my hand. On the cervical spine I still use my thumbs. I think it's just a bit more accurate that way. And then from here we can either start from the top or the bottom. I'm going to start from the bottom, and I'm going to just do a general, I always like to do a general feel of the neck, see if anything stands out. Remember that alignment, 45 degrees or up towards the eyes when you get to the mid-cervical spine level. And then if anything does stand out, I'm going to explore that a little bit more. So I'm pressing through the range there, we're looking, is it stiff, am I getting restriction, am I reproducing, most importantly, am I reproducing any symptoms or pain? I think when we're looking at mobes of any part of the spine, the only thing we can say we're 100% accurate on is reproducing pain. Yeah, so we can do the best we can to align ourselves on levels, but ultimately we may be one out above or below, but if we can reproduce the pain significantly, that's going to obviously affect our treatment. If I want to look at it fully, I have to come around the other side, and then from here I'm going to do the same thing, and I'm going to assess the left hand side. So really nice position here for looking at PA mobes of the cervical spine. We can change it a little bit as well, so we can, if we get our problem more in rotation, we can bring Ben more into a slightly rotated position and then assess there, yeah, or lateral flexion. We can even laterally flex slightly, bring the shoulder up and assess it in that position as well. So you can modify the position slightly to replicate what your patient reports as their symptoms.
Hope you enjoyed the video guys. If you did, then please give us a like and subscribe by clicking up here. Also don't forget to go over to strengthphysio.com and check out our members area, which has basically got our full library of all of our videos. You can get there by going to strengthphysio.com/members. Hopefully I'll see you on the site, and I'll talk to you all soon.